Hi, I'm Steve Adubato, and welcome to a very special segment connected to the COVID vaccine, What You Need to Know. That is the name of this segment, and we're thrilled to be joined by Mike Maron, President and CEO of Holy Name Medical Center, and also Dr. Adam Jarrett, Chief Medical Officer and Executive Vice President at Holy Name. Good to see you, gentlemen.
Thank you, Steve. Good to see you.
Mike, we're taping on the 13th of January. Be seen later. For those who want to check out what's going on every day, check out NJ Spotlight News and Metro Focus for that. Mike, biggest lessons we've learned so far from your perspective about vaccine distribution?
Well, it's a very complex process. So most people are familiar with the flu vaccine and how we roll that out. This one is very, very different. So the logistics and the complexities behind deep freeze vaccine that needs to be thawed, then diluted, and then not wasted, and has very limited, once it's diluted and vaccine ready, it only has a 6-hour shelf life. So there's logistic issues, and then the emotion and the demand around it is just off the charts. So all of that has really necessitated discipline for us here, because we write our own software, to write software to facilitate registration, scheduling, communication, and follow-up. That's essential.
By the way, let's do this. Let's put up the CDC website, then the New Jersey COVID website, and also the Holy Name website so people can find out more if we can, Nicole, okay? Dr. Jarrett, let me ask you, taping on the 13th, say this is seen on February 13th or on March 13th. So many variables, so many factors we don't know. However, where do you believe vaccine resistance will be at that time? Make a prediction. Mike said demand is strong, but so is resistance in certain pockets. Go ahead, doctor.
So you raise a good point, Steve, and I do think we need to reassure the public that the vaccine is very safe, that we are already well into giving vaccines here at Holy Name and around the country, and we are not seeing significant reactions. People need to rest assured this vaccine is very safe. And when you compare it to the risk of COVID-19 and the fact that we continue to see deaths in tremendous numbers throughout the country, it's not even a close comparison in terms of how safe this vaccine is. I hope the American people hear that, and I hope they understand that we finally have some light at the end of the tunnel. We can see a summer ahead of us, or certainly a fall ahead of us, where COVID is not wiped out, unfortunately, but we are no longer in this pandemic situation where we can take our masks off, where we can go to restaurants, where we can travel, where people can go back to work. That's where we're headed if everyone takes their vaccine.
So, Mike, let me ask you, on the resistance end, I'll ask the same question to Dr. Jarrett. Resistance on the part of frontline healthcare workers. As we're doing this program, I've seen some numbers, 40, 50% of frontline healthcare workers resistant. I don't know if that's accurate. A, do you believe it's accurate? B, again, seen a month, 2 months from now, do you also believe that will change as there are not reactions to the vaccine? Mike?
Yes, and I think, Steve, very, very important to really sort of reclassify that, not so much as resistant as uncertain. So
what's the difference, Mike?
Well, the difference is that people are concerned. Is very new science. We've never developed a vaccine this way. It's first time ever. There's no doubt it's on a fast track. And so the emergency use authorization that we're using to administer this drug, we have to have people sign consents. Basically, this is still an experiment from an FDA overall, how normal processes for drugs to roll out to market. This is very fast paced. So I get the people's hesitation, but as Dr. Jarrett said, right, the risk of the virus is far greater than the risk of the vaccine. And I said to someone earlier this morning, if you came and saw all the 50-year-olds on ventilators right now at Holy Name, you would think twice and say, I'll take the vaccine before I end up like that.
You know, Dr. Jarrett, as we listen to Mike, and we've had several conversations with him from the beginning, and we can disclose that, Mike, you had COVID. When again? Put that in perspective.
In middle March, March 17th, actually.
Again, 2020.
2020, correct, yes.
So Adam, let me ask you, Dr. Jarrett, let me ask you, as it relates to this other strain, and again, we don't know how things are going to play out 13th of January, this other strain of COVID, to what degree does it concern you, A, and B, what assurance can you give people that the vaccines that are out there and the ones that will be out there will deal with this other strain of COVID?
I think your audience needs to understand that viruses are mutating regularly. It is not something that we are surprised when it happens. In fact, we'd almost be surprised if it didn't happen. And it is why we need to do a different flu shot every year, because the flu virus changes. But in the amount of time that the COVID virus had changed, it is extremely unlikely that the vaccine is not going to be effective. It does tell us that we may need to think in the future that we may need to do an every couple of year COVID vaccine that may need to change based on the fact that the virus is changing. But all good evidence today tells us that although there is a new strain out there that is likely more infectious, but thank goodness not more lethal, the vaccine should protect us.
Got it. Let me disclose that Holy Name is, in fact, one of the healthcare organizations that underwrite our healthcare programming. Mike, I'm curious about something. I've asked you this before, but I want to fast. It was about 6 months ago when I asked you it last time. How do you believe COVID will impact hospitals and what hospitals look like and how they serve people moving forward?
Well, I think, the silver lining, if there is one in all of this, Steve, is it's forced the hospitals to re-examine how we engage with our communities. Telemedicine is now big. The rollout, the scheduling, the communication that's around these vaccines. These are all infrastructure that will now be applied going forward in a whole host of activities. It doesn't have to be limited to COVID-19 vaccine. And shouldn't be. And so I think ultimately it is going to enhance and accelerate the connectivity between healthcare providers like Holy Name and the communities that we're here to serve.
Dr. Jarrett, the role of public health. How do you believe the role of public health entities, CDC on the federal level and then state, county, et cetera, municipal level, how do you believe the role of public health will change in the face of COVID moving forward?
Well, I think this pandemic has showed us that we have work to do on the public health side. I am not so sure as a society that we have put the type of investment into public health that we need to. We do a pretty good job investing in acute care. I'm not so sure we do as good a job investing in public health. And although we need acute care to take care of patients who have COVID-19, I think some of the reasons we did not do as well with this pandemic, and maybe we're struggling a little bit with getting out the vaccine as compared to countries like Israel, is because we don't and we haven't invested in the public health infrastructure. And that's extremely important because we're going to have another pandemic, maybe not in our lifetime, but or maybe in our lifetime, but this is not going to be the end of the human race fighting these types of viruses. We need to be better prepared.
Mike, last question. Impact long-term COVID-19 on the frontline healthcare workers at your place, but also in hospitals across this nation?
So it's going to be mixed. We have those who are suffering burnout and post-traumatic stress from all the illness and the death that they've seen as a result of this virus. That's giving people pause and concern. But I would tell you on the flip side, the heroic efforts that people have done and the notoriety that's come with it has spawned a whole new interest in people coming back into the industry, coming back into nursing. We're hoping as we open up graduate medical education here, more people wanting to get back into being physicians and participants in medicine. We see that as well. And so it has all the potential, if we don't mess it up, to really, really nurture and encourage the best and the brightest in our communities and in society to come back and join healthcare.
Thank you, Mike, but also a special thanks to Dr. Jarrett, not just for being someone we're learning from every day. And again, check him out. He's been on NJ Spotlight News so many times, along with Mike and other healthcare professionals. But on behalf of all the frontline healthcare workers, it may sound like a cliche, but it's not. You're all heroes. And thank you for everything that you and your colleagues have done, Dr. Jarrett. Thank you, Dr. Jarrett. Thank you, Mike.
You're welcome, Steve. Thank you.
Steve, stay well. Take care.
Same to you. I'm Steve Adubato. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Healthcare Foundation of New Jersey, Delta Dental of New Jersey, NJM Insurance Group, New Jersey Sharing Network, the Robert Wood Johnson Foundation, the North Ward Center. the Russell Berry Foundation, Rutgers University, Newark, and by United Airlines. Promotional support provided by Meadowlands Chamber and by bestofnj.com.
Right now, 6 feet can feel like a long ways away. But from 6 feet, we can still smile at each other. From our doorways and our stairways, from opposite sides of the street and opposite sides of the country. Through fear and frustrations, we can remind each other that we are still here for each other. Because we can still smile at each other. And we're not going anywhere.